I'm Peter Block at ACC.11, and with me is Dr. Sun Park from Seoul in Korea. He has, as everyone knows, been the leader in dealing with left main coronary stenting. So, Dr. Park, we now have the PRECOMBAT trial. Tell me what the PRECOMBAT trial was.
Yes, PRECOMBAT study is called prospective multicenter randomized studies with a PCI with Sirolimus-Eluting stent versus bypass surgery for unprotected main coronary artery disease. That's it. And we compare with as a primary endpoint, composite endpoint death, MI, and stroke, and including the ischemic-driven TBR. And a basic study was designed in non-inferiority study of a PCI versus surgery.
So this is a non-inferiority study,
Yes.
not a superiority study.
Yes, it is.
Okay.
Right.
And did it end up being a non-inferior?
Yes, it is. It was actually in a 1 year MACE rate. The primary result was met in the non-inferior, so PCI versus bypass surgery. And 2-year follow-up data, including the main MACE rate, actually we didn't find any difference, even including the TBR. So, with a PCI, we didn't find any difference in terms of a MACE rate at the 2-year follow-up.
So target vessel revascularization was not driving this in any way?
Yes, we separate heart endpoint, death, MI, stroke, absolutely almost same. However, the only difference in the 2 years follow-up, 1 year follow-up period, no difference at all. So, however, at the 2-year follow-up, we have a statistical difference in terms of ischemic-driven TBR. Actually, we analyzed again a clinically driven TBR is quite similar between the two. So, overall data, anyways, including the TBR primary endpoint is quite similar with the PCI. With a Sirolimus-Eluting stent versus bypass surgery.
Now, we were chatting before we started all this about the bifurcation stenting versus the body of the left main. Tell me about that, because this is fascinating. There's no difference between those two groups?
Yes, at the 2-year follow-up, in terms of bifurcation and non-bifurcation, as a subgroup diabetic, non-diabetic, we didn't find any different type of treatment, different interactions between the two, and so we didn't find any difference. So
okay,
far, right.
So to summarize, it seems to me that it's certainly non-inferior to have a stent rather than surgery for left main stents. This is unprotected left main. We should emphasize that. No difference between bifurcation and main body, a very important issue. And so I guess I have to ask you, if you had a left main lesion, would you rather have a stent or would you rather have surgery?
It's actually depending on patient selections. If you look at it, this is random studies. A random study actually had an inherent kind of a limitation, right? We have to select a subgroup, and so the patient who had a relatively young and good LV function is less comorbidity status, and actually those patient group with quite good clinical outcome with a PCI.
Thank you, Dr. Park.
Right, thank you. It's my pleasure.